So this is a video on trans-ischemic attacks for family nurse practitioners. Trans-ischemic attack is usually called a stroke warning. That's because people who get TIAs are at very, very high risk for a stroke. A stroke is also called a brain attack. What's the difference between a stroke and a TIA? We want to know this because they are actually super, super similar. So here's a clot which is blocking, well, let's pretend it's totally blocking blood flow. Blood's trying to come up here, it can't go here, it can't go here. So this part of the brain up here is not getting any blood. Where with a trans-ischemic attack, we are likely having a full block, but there is another way for blood to get around. And the block might not be totally occluding. It may just be mostly occluding, meaning that the area is not getting, it's getting so little blood flow that there are going to be symptoms. Okay, and here is the acronym FAST, which every person should know for stroke. So their face, there's going to be facial drooping or an uneven eye or an uneven smile. In the arms, you're going to have one arm weak or not be able to lift both arms. In terms of speech, you're going to listen for slurred speech. You don't know if people are going to possibly understand your speech. You might not be able to come up with the word that you think that you're coming up with. And then the last part of it is time. It means go immediately to the hospital. So TIAs, what other symptoms are we going to see? It's going to be that unilateral weakness, heaviness, or clumsiness in majority of the patients. The unilateral sensory symptoms that we talked about might have trouble seeing, let me go back to the page, might have a partial vision loss, unilateral hearing, might have some vertigo or a headache. These patients are likely going to have slurred speech. So you might be thinking at this point, okay, these symptoms all are symptoms of stroke, especially these. This was made for stroke. These are all symptoms of stroke. How do you know it's a TIA? And the answer is time. So with these patients, you're going to likely have these symptoms for a couple minutes at most, and they are going to last up to 24 hours. If it lasts any more than 24 hours, you're thinking, okay, this is a stroke. We're pretty concerned that this is not just a TIA. All right, so what are the risk factors? And they're the same risk factors for stroke. The non-modifiable ones are getting older, having vascular disease, heart attacks, and stroke, or having a prior stroke or TIA. Because remember, a TIA is a stroke warning. The ones that we can help are the modifiable blood pressure. So as soon as we see a TIA, we want to make sure that we're treating this patient really well with high blood pressure medications. We want to make sure we're treating their cholesterol well, their AFib well. We want to make sure that they're compliant with their diabetes, changing their diet. If they're overweight, they need to lose weight and stop drinking so much alcohol. We want them to be exercising, not smoking, not using illicit drugs, and be a little bit more relaxed because that can change your blood pressure. Okay, so once we start with this patient, we know that this patient is going to need an antiplatelet drug because they're at higher risk, right? Higher risk for having a TIA. We know that long-term platelet therapy is going to be indicated for this patient. So aspirin is an option that is not going to be sufficient for the TIA patient. You could do aspirin with diopramolol, which is Agronox. This is an option, and it's one of the cheaper options. Plavix is an option, that's clopidogrel. And there's one that I don't see here, which is Xarelto. I think that there's one more too that I'm not seeing here. Oh well, I think that's enough. Okay, so types of stroke. Ischemic strokes are going to be the most common ones. This is about 80% of TIAs. If we have a cerebral hemorrhage, that's going to be like about 10%. And then the subarachnoid hemorrhages are pretty low. And this is going to be the drunk person that falls down the stairs. It's more indicated with injuries. Okay, so what do you do if you have a stroke? We want to get this person to the hospital fast because time does matter in how we're going to treat this patient. All right, hope that was helpful, and have a wonderful rest of your day.